Okay, my name is Christina Arietta, and my test is right hand versus left hand. I will be looking at signs of mental illness in people who are right-handed and left-handed, but I will be focusing on the people that are left-handed. I will be measuring mental illness aspects such as depression, bipolar, and mood disorders, focusing on questions regarding signs and symptoms of schizophrenia. So it's important for me to go over schizophrenia first and mental illness signs because I'm going to be having all these questions in my test, but I will be focusing on schizophrenic questions. But you will see depression questions, bipolar questions, and mood disorder questions. So to do this, I must understand the signs and symptoms of schizophrenia that is prominent in people who are left-handed. So people who are schizophrenic will experience hallucinations, delusional thinking, trouble concentrating, inappropriate emotional response, and impaired motor coordination. And this is a good picture of a normal brain and a schizophrenic brain. So when it comes to the history of people that are left-handed, there's been many studies done on left-handed people and how the percentages of left-handed people with schizophrenia outweigh those of right-handed people. So my test will identify if a person has higher symptoms for schizophrenia based off my questionnaire, and I will also be looking at a broad spectrum of mental illness who are in an inpatient setting, and the testers are not random because they're all inpatient. When it comes to the history of some of the past studies done, when it comes to the left side of the brain versus the right side of the brain and right-handed versus left-handed, I have some on here. The first one is from Corvallis, and it says a past study on the left brain versus right brain suggests that people who are left-handed have a weak cerebral lateralization and learning disabilities. People who use both left and right hands without a dominant hand have shown to have increased diagnosis of schizophrenia. And then there is another study that shows that people from Jaden, that people from Yale University, that people who use one side of the brain versus the other side of the brain are more dominant in certain aspects. So that's why I have this picture that describes people who think with their right brain versus the left side of their brain, but it also goes with right hand versus left hand as well. Like people who are right-handed could be more creative, and people who are left-handed could be really good with numbers. So this is just a great picture that can also correlate to right hand versus left hand. My test. My test will identify if a person has higher symptoms for schizophrenia based off my questionnaire. It will be 25 questions, yes or no answers, and the final question, the last question on the test, is if they're right or left-handed. Because the constructs are unobservable underlying traits, I need to develop a test that describes the difference between left-hand and right-handed answers among testing conclusions. I will be developing my test off similar yes or no questions, and the content of my test is specified in the DSM-5, and it will be related questions like they have in the DSM-5 when it comes to mental illness associated with schizophrenia. this is an example of, actually this is test questions on my test, but this is only a few of them. So the first question says, you feel as though you have an abundance of racing thoughts throughout your day. Yes or no? This is a mood disorder question. And then the second one says, you feel tired a lot throughout your day and lose motivation easily. This is a depression question. And then the third one, on most days you are not in control of your own thoughts or ideas. This is a schizophrenic question. So I will have more schizophrenic questions on my test than I will have mood disorders or depression questions. But if they answer yes to question 3, they're more likely to answer yes to more of my schizophrenic questions. And then we will see at the end if they are right or left-handed. So what is my question? My question is, what percentage of inpatient psychiatric unit patients are left-handed, and the ones who are left-handed, are they schizophrenic? So who will I be testing? I will be testing inpatient psychiatric patients who have been in the behavioral health unit for a minimum of 1 week. And I'm saying a minimum of 1 week because I will be giving this test twice. And 1 week to be in there also means that they are comfortable. Inpatient psychiatric unit, when patients first arrive, some people are there and it's their first time there and they have no mental illness, no prior history, nothing, and they were, Baker acted by a family member. So I want to make sure to weed out these people. So people that are there for a minimum of 1 week usually do have mental health disorders, and this will make sure that I am focusing on people that have mental illness. So past tests that are similar to mine, there is one that is called Schizophrenia QOL scale, and it evaluates schizophrenic patients, and it contains 30 items on 3 subscales. This test is like mine because it evaluates schizophrenic patients, and it would be asking along the same questions, but the test itself is just measurement based. So this is what the test looks like, and so they're measuring the quality of life in schizophrenic patients. I thought that this was important to look at because they're looking at different factors like I would, and they're totaling it up. Like at the end, I have to total up to see if people answer more yes to schizophrenic questions. And then there is the positive and negative symptom questionnaire, the PNSQ. And what it does is it asks questions. It's a self-report. So it asks questions to patients that I have on my test. And it measures if a patient is schizophrenic. So this is the test, and these are all the questions that a patient would say check yes or no to. And all of these questions on here are for analyzing if a patient is schizophrenic. So some of the questions say things like, sometimes I hear voices that say bad or good things to me, yes or no. Schizophrenic patients are more than likely 90% of the time, I would say, because of my past experience, going to say yes to that. So just like on my test, I'm going to have questions on there. Schizophrenic patients do hear voices. They hear thoughts in their heads all the time. They get interrupted. They think things like question number 5 here, where people can read their thoughts. So this is a great similar test to mine. They're just not going over if a patient is left or right-handed. The tools I will need for the test are a mental health professional, pencil, and my questionnaire. So the mental health professional will go into the room, give the patient a pencil. This is why I love this pencil, because this is the pencil that will be used. Inpatient psychiatric facilities do not have erasers on their pencils because they can do bodily harm. So the mental health professional will be administering the test, and they do not have to be in the room. They can stand outside the door, but they do have to also observe behaviors. And it's very simple. They'll just have a questionnaire and they check yes or no box. So to maintain reliability, I will need to be given this test twice in 1 week, and this is also known as test retest. And I put a definition here for what test retest is, and it says assessing test retest reliability requires using the measure on a group of people at one time, using again the same group of people at a later time, and then looking at a test retest correlation of the test scores. So this would be test retest scatter chart of correlations, and this is a great example of how it verifies reliability. You can see on this picture that this test was given multiple times, and that you can see on scatter charts how it does verify that a test is reliable. Validity, I will be having content, face, and criterion. The content is how well my test measures behaviors. Like I said, there will be some monitoring behaviors, and it will also ask questions on my test about behaviors. The face is my test measuring mental illness in patients and seeing if schizophrenic signs are in those who are left-handed. And the criterion is because I'm using past testing questions based off mental illness questions. The purpose of my test is to justify mental health opportunities early on in life for for children who are left-handed. So coming from a mental health background, what I have noticed is that people do not have mental breaks until they're 18 years old usually, and by that time it's a little too late. They've already gone through so much. It's harder to get them on medications. It's harder for them to shed insight. So the purpose of my test is to see if your child is left-handed, that we can get you mental health resources quicker than waiting until someone is 18 years old. Schizophrenic is something that gets worse as you get older unless you get on medications for it and educate yourself about it. So another one is mental health awareness and education in schools for people who are left-handed. There is research out there that suggests that a huge percentage of people that use their left hand suffer from mental illness versus people with their right hand. So why aren't we having those resources out there for them? So that's the purpose of my test. And that is it. These are my references. And I hope that my test shed some insight into mental illness and bipolar and mood disorders are all real, but I want to shed insight into mental illness with people that use their left hand and see if we can get some resources out there for people who use their left hand. And that is it.